Annually, there's 125,000 patients dying every year because they simply don't take their medications. And we found through the Gallup survey, 2/3 of the time that a patient doesn't take medication, they don't take it because they simply can't afford it. We simply can't afford not to address this market failure and not to lower prices.
This is an area where there's consensus, there's a problem, because it's a sector where you have a regulated monopoly, right, for a product that is vital to human need.
The reason why monopolies are considered generally to be market failures is the way a monopolist maximizes its profits is by restraining supply. That's a major issue. We're triaging every day, just trying to get drugs that frankly were developed 80 years ago. They should be available and affordable to everybody. It's a massive problem. But that's one of the reasons why we started Civica. So Civica Rx is a not-for-profit generic drug company. The mission of Civica is to make sure that essential generic medications are available and affordable to everyone. Generic medications are those medications that have reached their patented life, that they, are formulas that ultimately enter the public domain are really owned by society. And unfortunately, in many of those markets, certain people, the Martin Shkreli's of the world, have gone in, cornered a specific manufacturing line. So I thought, what if we got together with hospital systems around the country who buy these drugs every day with payers and just say, enough. So we came up with that concept, we built it, we launched Civica last September. The response has been unbelievable. We've raised about $180 million. And more importantly today, 25% of the US hospital beds are already signed into the Civica model. For health systems, there was a real clear value proposition. But our ask to the philanthropy partners we have, the Gary and Mary West Foundation, the Laura and John Arnold Foundation, the Peterson Center on Healthcare was, help us stay honest.
Optimistically, I think this will start to get more and more attention. I want to commend you all at West Health for focusing energy on this.
All the options that we had seen as to how to try to get at the abuses that were happening in the generic drug industry, we found the Civica model to be the most promising.
I'm really excited to be part of Civica. This is about doing what is right and doing what is right for patients in America.
Our vision for Civica down the road is that it's a positive force in the market to make sure that nobody could ever monetize Civica, that some board 20 years from now wouldn't vote to just make this a for-profit business and raise prices on people. Our shareholders are really society at large, and that wouldn't be possible without folks like the West.